Hi, everybody. In our last video, I was talking with our public health intern from this spring, Bennetta Clarke, and she was telling us about the community health survey that she and her partner intern did this spring, interviewing and talking to members of our Abundant Life community about issues that mean something to them when it comes to health. And Bennetta has graduated from UNC Greensboro, but I'm here today to walk us through the results of that survey and talk about some of the things that Bennetta and Ismael heard from you all. So I want to share with you some of the results of our community health assessment. First of all, if you look here, you'll see that from everybody who responded, over 50% were either Black, African-American, or Hispanic Latino. We've got a big community of color. We also had African and biracial and Native American people who responded, as well as 18% white. So our community is got a lot of things going on. What people talked about as health problems that were in their homes, the biggest ones were diabetes and cardiovascular disease, but then also arthritis, lung disease, asthma, allergies, mental health disorders, and how that affects not just an individual, but their whole family or everybody in their house. And you'll see in the other category, it's a little bit littler, so I'll read it for you. What else people talked about as far as health problems are concerned were nutrition, eye diseases, chronic pain, obesity, cancer, sleep disorders, skin disorders, and neurological disorders. What our interns found in their conversations is that 1 in 4 people who talked to them said that unhealthy eating habits were a part, or they thought were a part of what was going on with their health and their health concerns. And then listen to this. Out of everybody they talked to, 1 in 3 people said that there has been a time in the recent past or in their lifetime, but many people said in their recent past when they needed medical care and didn't get it. One thing we'd like to talk about as a community is what are the possible reasons? What's going on there? Has that been your experience too? Finally, how has COVID-19 impacted our community? A lot of people have lost work, and that means they've lost income. Lifestyle changes related to when we can go out, mobility, stress and fear and isolation, and death, loss of childcare. And when you all talk to our interns, here are some things that people said that we'd like more resources and education about. And we hear you: housing, food security, nutrition, diabetes, mental health, more information on COVID-19, technology, and overall health and wellness. So that's a lot. There's a lot going on in our houses and our neighborhoods and our communities. And not all of it's bad, but our health is connected to our spiritual and our emotional and our physical well-being, and the well-being and health of our neighbors and our family members and everybody who lives with us. So at Abundant Life, we want to be able to address these concerns together with our community, with our partners, and find a way for God's dream for health and healing for all of God's people to become a reality. In the comments box, if you need to rewatch this again so that you can go through the survey results, but drop a comment in the box about something that struck you, either as like, that's my experience, or I wonder about that, like what's going on there? Let us know what's most interesting and important to you, because this summer we're going to be having some community gatherings where we can talk about these issues and also think up some strategies for how we can all become agents of health and healing. So it's good to see you. God bless you all, and look forward to seeing you next time. I'm the Reverend Audra Apt and Abundant Life Ministries, and we are part of our community.